And the reason we can't answer it is it's very simple to think about it in the abstract, about, oh, people don't get health care. But when I look at you as another human being, or you look at me as another human being, to stand there and look you in the face and say, I think you should die, it's not possible. Well, I mean, unless you're a sociopath or something, but it's just not possible. So Vermonters came together, built this big movement on human rights principles, and said to our legislators, we want health care as a human right, and we want you to pass a law that says it is. And they said, well, what do you want it to say? And we said, we want it to say health care is a human right. You work for us, you read it. So they did, and of course then we got to review what they wrote, and we went back and forth and that sort of thing. But this was a bottom-up power structure, not a top-down power structure. And that is what changed what was politically possible in Vermont. And the year before last, Act 128 was passed. It was very simple. It simply said, healthcare is a human right in Vermont. These are the 5 principles. And we recognize that our healthcare system is broken and the legislators have to fix it. So they're going to hire a consultant to give them some ideas on how to do that. And they had to do that by a certain date. And that law was passed the last day of the session. And we had a Republican governor who was very opposed to it. And we had Republican legislators who were opposed to it and Democratic legislators who were opposed to it. Politics didn't really make a difference, and I'm only mentioning it to say that the governor in power at the time was not in favor of it. However, the governor knew, based on what the people had done, that he shouldn't veto it, because if he did, his veto would probably get vetoed. So he has the option in Vermont of just not signing it, and if he just doesn't sign it for 90 days, it's law. So he just didn't sign it, so it took 90 days for it to become law. So that report came in, and that was done by a Dr. Shao from Harvard, who is a really well-known economist and who most recently set up Taiwan's healthcare system. And he made several recommendations because he got the bid, and the law said you have to give us 3 examples. 1 single payer, 1 public option, and 1 of whatever you think is good. So he made those recommendations to the legislators. And last session, they had to decide which they wanted. And actually, he wound up recommending a 3rd option, which was sort of a single-payer, multi-pipeline option. But what was really important about that is that the people again got together and said, this is great, whatever law you pass, at whatever form you pass this in, it's up to you, but it has to meet the 5 principles, which of course makes it impossible for them to pass an insurance-based system, because an insurance company isn't possibly going to be accountable to the people. They're accountable to their shareholders, their board, whomever it might be, but certainly not the people of the state who are involved in the health system. And also we said, this is a public good. Healthcare is a human right, it's a public good, just like our fire departments, which means it should be treated the same way. Now, our fire departments are established because we know we need them. We don't want people's houses burning down for lots of reasons. 1, because the whole town might burn down, and 2, because that's going to leave a family without a home. So we have fire departments, and no one would argue that there's anything wrong with having a fire department. Healthcare as a human right is the same way. It's a public good. So the act that the governor signed last May said healthcare is a public good in the state of Vermont. And that wound up to be a really important point. And it said that anything done under this act has to comply with the 5 human rights principles. They have to be there no matter what's done. And we all know that our government likes to privatize all their public goods. They're always, whether it's the healthcare system, the jail system. I mean, In Vermont, we wind up sending folks who are incarcerated down to Virginia because we don't have enough prison space. In Vermont, it costs $300 a day to have a person in jail. In Virginia, it costs $600 a day because it's a private system, and it's always going to be more expensive to privatize that public good. So that's what we don't want done with our health system. So that's why that was so important and so crucial to the whole procedure. And recently, a company from Germany tried to buy the dialysis machines from our hospital in Vermont. And they've done this all over the country in many states. And their outcomes aren't necessarily very good. And the nurses union and the people of the Healthcare as a Human Right movement reminded the Green Mountain Care Board, wait a minute, this act says that healthcare is a public good and has to be accountable to the people it serves. How can this private corporation, responsible only to its shareholders, be accountable to the people of Vermont? And the Green Mountain Care Board said, you're right, we're blocking the sale. So this is a great example of how each of us as people, when we stand together as human beings, can change what's politically possible. And I do have a PowerPoint presentation, and I'll just say that the Vermont Workers Center was founded to take care of problems of working folks, and we still have a hotline. And as years went along, we found out that the most complaints were about health situations. So they went out and they sort of did a door-to-door survey, and everybody, not everybody, but the vast majority of people said that their main concern was healthcare, lack of healthcare specifically. And that's how the Healthcare as a Human Right got founded. And this is always giving me a hard time, so I just have to close that. And you know, you probably haven't heard a lot about Vermont's new law or Vermont's system because there is a media blackout going on. And it's really true. I mean, 2 months after the law was passed, I was talking to some folks in New York, and they said, wait a minute, our border is like 40 miles from you guys. How come we didn't hear about this? And you'll notice it wasn't on CNN. It wasn't on any of the major news stations. Why? Because that's an effort by the people who lost power to the people of Vermont to try and keep anybody else, like you good folks, from getting the idea that you really can change what's politically possible. And one of the main organizing tools that we have is this t-shirt right here that is red and says healthcare is a human right. And we wear this all the time when we're in the State House, if we're sitting in the rotunda, the legislators see the red shirts there and they know that what they're doing is going to go back to the Healthcare as a Human Right campaign. When we come together for meetings, we can see who are our supporters and who we should talk to. And you can see this is a rally that we had, and you can see red shirts and the Healthcare as a Human Right signs. And it's really a useful tool because it stands out and it identifies us to each other. And in fact, the newspapers, because the local newspapers do give press to all of this that was going on, they had to. And they would say, and the red shirts were there, meaning the Healthcare as a Human Right campaign. So it really became an identifying mark.
How many years did it actually take from the time you started until this bill was
3 years.